What's up, everybody? My name is Zach, and I'm the Chief Marketing Officer at Strive. And I am so stoked to introduce to you today Strive Sessions, which is our series of webinars that we're going to be releasing. I want to say right up front, this isn't going to be your typical boring webinar where you're just trying to absorb way too much information all at the same time. Our goal is to make these engaging, entertaining, and for you to leave each of these webinars with the not only the knowledge, but the know-how and the practical, applicable steps to take to apply these things into your practice so you can better support your patients. So in true Strive fashion, we're gonna do it better and different than what's ever been done before. At Strive, we genuinely believe in the important role that compounding plays, not only in your practice or in the individual lives of your patients, but also at a nationwide scale in the US healthcare system. But in order for compounding to truly grow to the size we believe that it can, education plays a crucial role in that. As a compounding pharmacy, we want to invest in education. We want to invest in your knowledge, in your learning, in your capabilities. Because the more confident that you become in compounding, not only in the quality of compounding, but also in the clinical applications of the ways that these medications can benefit and bless the lives of your patients, the more capable you will become over time in prescribing these medications specific to your patients. So obviously with this particular session, this is a pre-recorded session, but throughout the Strive Sessions series, there's gonna be a mix of pre-recorded information. Some of them will be live. In all of them, we are going to have live Q&A during and after whatever is presented. So even in the case of this webinar that you are watching, we are going to have a couple of our clinical pharmacists on standby watching the chat. So if you have questions that come up, feel free to put them into the chat and they will respond to you accordingly. But we're also going to save some time at the end for some Q&A. So if there are questions that you ask that are common questions or a lot of people have, then we will answer those with even more intention after the main subject matter is shared. All right, so first up on the docket for the webinar today, I'm going to transition over to Andrea, who heads up our clinical pharmacist department. And as a side note, our team of clinical pharmacists is one of the ways that we invest in your knowledge and capabilities and confidence as a healthcare provider. These pharmacists day in and day out are speaking with providers like you on an individual basis. They're engaging with audiences at speaking engagements across the country. They're contributing to critical clinical information that's used for our products on our website and other materials. Like, they are a group of rock star pharmacists that are really, their primary goal is to support you. So Andrea is going to spend a few minutes to talk more about Strive, what sets us apart, what makes us unique, things ultimately that are just good for you to know as you work with Strive at any capacity in the future.
Hi, my name's Andrea. I'm a pharmacist and the Director of Clinical Services for Strive, and I'm really excited to introduce you to Strive Pharmacy. Strive Pharmacy is a compounding pharmacy. We're focused on flipping the script on personalized healthcare. Here at Strive, we're driven by our 6 core values. Those include being adaptable, innovative, resilient, trustworthy, collaborative, and egoless. You will find each individual that you work with through Strive Pharmacy encompasses all 6 of these core values. Working with Strive is different than working with any other pharmacy. You will have people standing beside you day in and day out, making sure that your business becomes as successful as possible. You'll have pharmacists to ask questions to, customer success representatives that are dedicated just to your business. You will also have sales managers that are going to help make the best decisions possible for your company. The quality of product that you will receive from Strive Pharmacy is unlike anything else. Each batch that comes out of our labs is tested at a third-party lab. At that point, they test for sterility of the product. Where other pharmacies may only test the potency of their product once a year, we test it weekly. We have an incredible compliance and licensing team. This team has helped to ensure that your patients can be serviced nationwide. This compliance team has also worked hard to ensure that Strive is accredited in both NABP and PCAB, as well as being Legit Script certified. Strive Pharmacy has 8 locations nationwide. The headquarters is in Arizona, and additional pharmacies are located in Texas, Florida, Virginia, 2 in California, Utah, and a central location in St. Louis, Missouri. So with that, it also includes quick turnaround times. Our expected turnaround times are 3 to 5 days, but depending on what tier you may be in, that can be expedited. If your orders are placed via our preferred pharmacy management system, those prescriptions will go into data entry very quickly. Our data entry techs will input them as quickly as possible, moving on to our pharmacists for the initial review. After that, the product goes to fulfillment. Our fulfillment techs work with pride. You will find the product is packaged perfectly with a label that's going to explain just exactly how your patient should use the product. When your patient receives their product, you will find that it is packaged in a way that appears that it is a gift for them. While Strive does specialize in GLP-1s, our product list is actually very extensive. You will find we have a great derm line, as well as hormone replacement therapy, nootropics, anti-aging. We're here to help all your patients' personalized needs. We take that personalized touch, not only for your patients, but for your clinic as well. We look forward to collaborating with you and helping to make your business the best it can possibly be.
All right. Thanks, Andrea. We appreciate you and your team. So next up, we had a chance to talk with our co-founders of Strive. We also felt it was important for you to understand where we came from. Why are we here? You know where we're going. We're going there together. Mike and Nate are incredible co-founders that believe in our mission, that believe in compounding, and we want to share some insights from them about why they started Strive.
At first, when Mike called me and told me about compound pharmacies, myself, like many people who first hear about it, have no idea what it is. I was, not in the pharmaceutical industry by any means, but over time, I took an opportunity to become a, pharmaceutical sales rep for a big pharmaceutical company. And, I had 3 or 4 different drugs that I would carry and go and meet with doctors about. And it was just interesting because I remember thinking like I'm selling a drug that's treating the side effect of another drug. And I think that's when it kind of opened my eyes that this is what the pharmaceutical industry is. This is what big pharma does, right? I do believe that there are a lot of medications that are beneficial, but they do look for opportunities to just push another product on people. And I think treating the side effect of another drug is a prime example of how that works.
When I first started pharmacy school, I started learning about all these medications from the big pharmaceutical companies. I never gravitated towards it. I really gravitated towards compounding, something that wasn't one size fits all. I would call Nate often and just tell him about compounding, how cool it was, and how there's a lot of applications in preventative care and optimizing your health, where our traditional healthcare system is mainly around sick care and how we treat those sick people. What about the opposite side, where we can actually help people stay healthy and not get sick? We both had a passion for healthcare, for preventative health, for optimizing your health. That's really how Strive was born and what it was founded upon. And that hasn't changed and is still our mission today.
Compound pharmacies, that's a really good example of where someone can go to not just feel good, but to feel great. One of the sayings that we always used was, why settle when you can strive? We're taking a more proactive approach instead of a reactive approach. A lot of people, they've lost a lot of trust. And so they're looking for this personalized approach because everyone's so different. Everyone's genetics and what's in their blood is different. And Those are the types of clinics we work with that are really looking at the root cause of the problem and trying to treat the person for who they are. And I think that's something. We have personal relationships with providers. We have personal relationships with patients. I think we've all seen over the last 5 years or so a big shift in the healthcare industry and people gravitating towards a more personalized approach, not always trusting what insurance companies are dictating or what big pharma is saying is what's healthy for people. And so people are working with providers that they actually trust. And this moment for Strive, I think what it did is it gave people the opportunity to rally behind something that they truly believe in. We've kind of surfaced as being this source of truth. We have a lot of providers, a lot of clinics, a lot of patients who count on Strive.
Back in the day, you worked with your doctor and the druggist to create something personalized just for you. We feel like our nation has gotten away from that. And so that's our purpose. We need to disrupt what's currently been happening and bring it really back to the roots of how medicine should be and how it should be personalized specifically for you. The way we operate here at Strive is we work with providers who see patients every day. They talk to them about their symptoms. They get lab values. They evaluate these patients. And oftentimes there's no commercial solutions that fit their exact needs. And so they come to a compounding pharmacy. We can customize an exact medication that the provider deems necessary, and we can make it exactly as that patient needs. We can adjust doses, we can adjust different concentrations of the medications, and we can do this all in a personalized way.
Something that we've done is we've gotten more people coming into our doors at Strive is educating people on all these other medications that we offer. Just because someone loses weight on a GLP-1 doesn't mean they're healthy. And we've been very vocal about that there's different things. They need to consult with a doctor. They need to look at their blood levels. They need to look at what their goals are. And we have a lot of medications that we personalize to those people so that it's not just, hey, everyone take this medication to lose weight. There's so many other benefits to that exact medication. And there's a lot of benefits to the other medications that we do. And it's been our mission and all of our efforts going towards educating people on the other medications that can help them, live their best life. Our medications are not the only way to improve someone's health. We believe in, eating healthy. We believe in exercising. We believe in having the right mental state. All those things are important for someone to truly be healthy. And I think we're just one part in that whole spectrum that can play a part in someone really truly feeling healthy.
As a pharmacy, we try to go above and beyond in all that we do, whether it's compliance, clinical operations. We try not to cut corners. The current state of healthcare in our nation is not ideal. There's so much progress that needs to be made, and we want to head that up the best we can. We want to provide education, really let the world know that there's other options when big pharmaceutical drugs don't fit. There's going to be other options, and a lot of those options are through compounding. Where we're going in the future is we want more people to know about this type of healthcare. Strive is all about people. We have people who take our medications. Those people have families. We care about the people in our organization, our employees. We care about our providers and them having the ability to choose what medications their patients are on. If you're a provider watching this, wondering how you can get involved in what's going on, please visit our website, strivepharmacy.com. We have a ton of resources there to help you get started with personalized medications for your patients. If you have questions on how to prescribe compounded medications or any questions at all, we have a ton of clinical pharmacists who can help you along your way, understand what type of medications we offer and how they can personalize those specifically for their patients.
And if you're a patient, you can also go to strivepharmacy.com. We have a lot of information on there about the different medications we offer. Also have a provider lookup tool. So you can go and find a provider in your area that currently works with Strive. But we also encourage you to talk to your provider about Strive Pharmacy and about compounded medications, and encourage them to reach out to us so that we can help educate them on all the beneficial medications that we can be offering their patients.
All right, I'm glad that you guys got to hear directly from Mike and Nate about why they started Strive. We felt like it was important for you guys to see, like at the founder level, how committed we are to our vision, to our purpose, and to our mission. I mean, we take it so seriously. We not only want to be revolutionary for this entire industry, but we want to be good business partners with you. And so without cutting corners, by prioritizing quality, by embracing the scrutiny that we face as an industry and as a pharmacy, like all of those things contribute to who we are and ultimately to how quickly we've grown our capabilities of serving you and your patients. All right, so to conclude, we got to hear from Andrea a little bit about Strive. Got to hear from Mike and Nate, our co-founders, about why they started Strive. I'm going to touch briefly one more time on the purpose of these webinars. It is our commitment to you for you to not feel like you wasted a single minute watching these webinars. We are here for the value, providing you value that you can apply into your day-to-day practice and all of your efforts. We're going to share concepts. We're going to share clinical information. We're going to share detail about medications. We're going to share best practices. There's all sorts of things that we're going to share. And we promise that as we share that information, we're also going to be giving you practical tips that you can do starting the next day with your patients so that you can feel confident utilizing what you've learned in these webinars. We are all in this together. We believe in the future of compounding. We believe in the role that compounding plays in this industry. And we can't do it without you. Compounding literally exists so that you as providers have the flexibility to provide personalized services to your patients. That's why we exist. Without compounding, as a healthcare provider, you would be limited to what's off the shelf. But because we don't believe that medicine should be one size fits all, we don't accept that as the only outcome. Compounding needs to exist. And so not only are we going to be investing in things like these webinars, we're investing in having a team of clinical pharmacists to support you. We are investing in infrastructure to be good business partners to you with great turnaround times, with a variety of medications, with other services to help you succeed. We're also battling for compounding on the front lines, whether it be through marching on the Hill in our nation's capital, advocating for compounding with lawmakers and regulators. We're doing all the things because we believe in this. And in order for this to work, we need to do it together with you. And so we're incredibly grateful for your support. We look forward to providing you value through the course of these Strive Sessions webinars. We look forward to seeing you at future sessions. All right, to wrap up, we are going to now do the live Q&A session that I promised. And so if you have any questions that you haven't shared in the chat yet, that you've just been super eager to ask, now's the time to do so. We have pharmacists right now on call on the chat that are ready to answer the questions that you have. And that's how we will wrap up today. So please send your questions in and we'll see you at the next Strive Sessions webinar.
I'm Andrea. I'm one of the pharmacists as well as the VP of Clinical Services for Strive. And I have along with me today, Valerie. So Valerie is a pharmacist as well as the Director of Clinical Services. And we're here to answer some of your questions and to dive deeper into who we are as Strive. Valerie, were there any questions that came in over the chat that we should start with?
Yeah, we actually got some questions before we even started. So I'm going to start with some of those. The first one I have for you is, what does NABP or PCAB certification mean? You touched on it in the video, so I wonder if we can expand on that.
Yeah, I would love to expand on that. We are very proud to state that we are NABP and PCAB certified, as well as LegitScript certified. So these are all voluntary accreditations that we have chosen to get, which means that we are put under a little bit more scrutiny than some other pharmacies that are not. So NABP stands for National Association of Boards of Pharmacy. So we ask these individuals to come in and check so many different standards of pharmacy.
and we passed with flying colors. We were really proud of ourselves. So what this does is it just shows that we comply with all state and federal regulations. It also signals that for both providers and patients. Now, PCAB is a little bit different than NABP. It's really the gold standard for compounding pharmacies as far as accreditations go. So that again, we had people come in, they checked our processes, they checked that we were following USP guidelines, they checked that we were following, FDA regulations as well as the Board of Pharmacy regulations. And again, that was passed. The last that I spoke about was Legit Script Certified. What this does for a lot of your companies is it allows you to advertise yourself as well. So Legit Script has come in and determined that Strive Pharmacy is a legitimate, trustworthy pharmacy that is following all laws, that is being very compliant. And with that, you're able to utilize Strive Pharmacy as one of your trusted pharmacies.
That's awesome. We're so excited, and the compliance team has worked so hard to get those certifications, so we really appreciate them. We do have a question in the chat, and I'm going to throw this one at you. It says, do you plan to compound E2 and T pellets? And I thought maybe we could talk about that, but also talk about kind of the medications we have in the pipeline or exciting things that are coming up.
Yeah. Absolutely, I appreciate that. So at this time, we don't compound pellets. Now, it's something that we have considered here and there, whether or not we will do it. I will tell you that we do compound hormones. So we do compound a lot of our hormones, or most of our hormones are bioidentical hormones. So whether that be progesterone, estrogens, so that would include estradiol and estriol, testosterone, pregnenolone, DHEA. So we do have the ability to compound with all of those, most often as creams, troches. We do have injectable testosterone as well, but at this time we do not compound the pellets. Now we do compound the progesterone capsules, which are oftentimes suggested to be utilized in conjunction with the testosterone pellets. So that's something to keep in mind. As far as what's coming down the pipeline, we have some really exciting things. Within our location in Missouri, which I spoke about in the video, we have put in new tableting machines, encapsulation machines. We have new sterile machines going, or sterile suites going in that are going to have robotics to help increase our efficiency. All of this is going to just allow us to increase and to continue to broaden our offerings. So all of it is very exciting. We have some really cool stuff up our sleeves. We actually have a few of our pharmacists in Missouri today learning some new techniques for compounding. So we're always evolving, we're always growing. We're always doing our best to give you as providers or you as patients the most current medications in the market.
Yeah, we're really excited for some of this technology that's coming out. So stay tuned with your Strive emails to see that. Another question from the chat that we like to answer quite a bit. What are some medications that can be prescribed along GLP-1s to make them more effective?
Oh, absolutely. So we do a lot of GLP-1s. That's kind of a hallmark for Strive. I will say we do our GLP-1s very well also. So we make sure, we spoke about it a little in the videos, but we make sure that the quality of our products is going to be the best across the board. But patients who are utilizing GLP-1 medications often need additional support. So one product that we do compound is called low-dose naltrexone. So when patients are on GLP-1 therapies, sometimes they will reach a plateau. When they reach that plateau, a lot of times it's because their bodies are maintaining extra inflammation. Low-dose naltrexone can help to decrease that inflammation. You also may notice that as patients lose weight, they start gaining more confidence in themselves. They start looking for products that are maybe going to help with, dermatology products or hair growth products. They're going to look for products that are going to potentially help increase muscle mass. Something like Samorelin would do that, which is a peptide product. So there's so many additives that can be utilized with GLP-1 therapy. I know some of our other favorites that have to do with cognition and energy would include NAD+, as well as methylene blue.
And a fun thing about our LDN tablets, if you haven't utilized them, they are flex dose tablets. So you can get 4 smaller doses in one. So you don't have to write 4 different prescriptions for capsules to get those doses as you titrate up on that medication.
Yeah, thanks for bringing that up, Valerie. And the FlexDose tablets allow for super easy, splitting of the tablets as opposed to, traditional splitting of tablets. So thank you for bringing that up.
Yeah, absolutely. One of the other questions we received prior to starting the session was, are you able to ship to all 50 states?
Yes and no. That's a tough one. So our compounding pharmacy in Missouri, it is licensed in all 50 states, but they actually don't compound every single product. So that pharmacy was acquired as a top-of-the-line dermatology pharmacy. But since we, as I said, have added so many other lines into that pharmacy, they are able to ship to all 50 states. Now, Arizona is very close to having 50 state licensure, which is so exciting. I think we're down to maybe 4 states that we don't have yet. Do know that all of the paperwork is in. We are just waiting for that final approval. But the other caveat is California. California doesn't allow us to ship all medications to their state. Now, we are working on, maintaining our sterile licensure within California, maintaining that great relationship with the Board of Pharmacy. That way we can continue to increase the number of products that we're able to ship into California. But if there's a sterile product that's not able to be shipped into California, a lot of times we'll have another option that isn't a sterile product, whether that be a troche or a nasal spray or just another form that we can get to your patients. So that is something to keep in mind.
Yeah, I love that. We do keep close watch on California, and we just try and get as many products into there as possible with our sterile products. So thank you for clarifying that. I kind of want to talk about this is maybe a harder question, a question we've been getting from some of our providers, being, hey, I call the pharmacy and I'm on hold for a very long time. Can you talk to, how many workers we have, who we're hiring, what we're doing to make these things a little bit easier for our providers?
Yeah, we hit our ups and downs when it comes to turnaround times and when it comes to answering phone calls. And we're constantly evolving and we're constantly doing our best to make sure that we can, maintain the relationships with you, maintain good service for yourselves and your patients. Right now, we have, I believe, over 50 customer service agents that are answering the phones constantly, and then additional pharmacists that act as clinical pharmacists to answer phones as well. We do have some fun things up our sleeves. We are soon going to have an online search that will allow you to search for where your medications are in progress currently, but we are constantly hiring. I believe I heard the number was we hired nearly 100 people in the last month, and we have 100 more open applications. So we're constantly wanting to bring more people in. That's going to allow better service for you. It kills us when we can't give you the best customer service possible, when we can't get those turnaround times exactly where we want to be. Believe me, it keeps some of us up at night. So just know that we are constantly evolving, constantly changing. We are adding square footage to many of our sites. We're adding new labs into many of our sites. As I mentioned before, robotics that are just going to really help to increase the efficiency of what we're doing.
Yeah, that was my next question was going to be on infrastructure and kind of what we're building out. Do you want to talk about maybe the Arizona location too? I know you talked about Missouri. We just got a new beautiful Florida location, all those things.
Yeah, you got a sneak peek into the Florida location in the video earlier. It is absolutely beautiful. But Arizona has purchased a building or has a building that's 250,000 square feet. That's the base. We are going to build a second story on that. So we are looking to have over 350,000 square feet of workable area. We're going to go from having 750 square feet of compounding space to 16,000 square feet of compounding space for non-sterile. We're going to go from having 2 to 4 lanes of sterile to having 16 lanes of sterile work. So we're not just increasing a little, we're increasing a lot. And the amazing thing is that we're leaving space so that we can continue to grow. We can continue to evolve and grow. I've said that so many times. I'm sorry, but as you can see, that is a focus for us. Is constantly evolving for you. So there is space within that building to continue growth. So we're so excited for it. We have some of the most incredible technology that is going into this space. As a provider, once it's open, I know we would love to show you around. So keep that in mind.
Absolutely. We love doing tours even at our current location. And just so you guys know, we continue to build out our current location. It's just we're going to run out of space at some point. So our team has taken these steps so that we can grow even more in the future. And we're so excited about it. Another question I have, and this actually fits in, Zach was talking about kind of helping with compounders on Capitol Hill, and they're actually there right now. So compounders on Capitol Hill is happening right now. So this is kind of a fun opportunity to talk about it. But anything that our providers can do or patients can do to help with our grassroots efforts was one of the questions we received.
Oh, yes, absolutely. We are working so hard. Like Valerie said, we have 5 pharmacists in DC right now, as well as some of our executives have been there this week as well. So we're really trying to pave the way for compounding pharmacy, really bring light to the necessity for personalized medicine, the necessity to keep these medications alive for your patients. So it's been quite the effort. But if you do go to strivepharmacy.com, you will see on that page there is a link that says, defend personalized medicine. If you click on that link, there's going to give you a number of different ways how you can continue to support us as we support the overall goal of maintaining compounding pharmacy in a positive light. So we're really proud of all the efforts we've done. It's really been a focus for us this last year. So all of us believe in compounding pharmacy. We believe in personalized medicine. We believe that your patients need these medications to remain healthy and maintain a great well-being. So thank you for asking that. I really do appreciate it.
Yeah, it's super fun to watch our advocacy team go to work. And I, at a local level, will attend Pharmacy Day at the Capitol in our states that we are located in. So super fun to go in and talk to just to the people who are on Capitol Hill. Excuse me. And yeah, we'd love your help in any way. You can certainly sign up, like Andrea said. I have one more question for you, and I'm excited about this one. What other education opportunities will you be having going forward? And I think that includes, Zach touched on Strive sessions and where we would like it to go, but maybe we can elaborate on how these are going to be different in the future. We know this one was pre-recorded and maybe not what everybody was looking for, but we do have big plans for the future of Strive sessions.
Oh, yes, absolutely. Education became our number one goal in the clinical department this year. So we're so excited to launch Strive sessions. You will find that our next session is going to kind of go into LifeFile, which is our pharmacy management system, help kind of give the ins and outs of LifeFile and how to use it properly. But then after that, there's actually going to be a survey at the end of this that I encourage you to fill out. And we're going to take your suggestions as to how to move forward. Now, obviously, we want to provide a lot of education on our products. We want to have guest speakers that can help, to just make this that much better, to help educate us as well as pharmacists. But we also have a number of other, educational opportunities. I know the clinical pharmacists do a lot of speaking engagements. We have been on a lot of other webinars. We hope to have podcasts soon. You'll find that we have great information sheets on all of our on most of our medications, for sure the top medications. The list goes on. There are rack cards and there are so many other things. And I'm actually going to turn this question back on Valerie because I know it's one of the things that she loves to speak on. But as the clinical team, how are providers supported? What makes us different than everybody else?
Yeah, I love this question. We are one of the few pharmacies to offer this. We have clinical pharmacists that are assigned to you as providers, right? So when you come on with Strive, you have a team. You have your sales rep, you have your customer service manager. They help you with live file your orders, and then you have your clinical pharmacist. When you need those clinical questions answered, that's when you get to get on a call with us. We have an entire team. We love educating our providers and our patients. So anytime you want to hop on with a clinical pharmacist on your team, you'll just let your rep know. We'll set up a meeting and we'll get you going down the road. We love talking about all of our medications.
Yes, the relationships we have with our providers is incredible, and is just one of our goals is to maintain that. Because if we can maintain a great relationship with you, we can help to make your business that much more successful. We can help answer questions that you may have for your patients. So it really is important that we maintain those relationships with you, and we absolutely love it. So I think we're going to wrap it up here pretty soon. I just wanted to remind you some of our goals as a compounding pharmacy are obviously to provide personalized medications for your patients, to provide the most compliant and the highest quality medications for your patients. As Valerie and I stated, education. We would love to continue with this education piece. So with that being said, as this concludes, there will be a survey that we would love for you to fill out. Please give us some feedback on how we can do better, how we can make Strive sessions something that really is valuable to you. Give us some ideas on some additional topics and whatnot. And if you have any questions, please always reach out to either your sales rep, info@strivepharmacy.com, clinical@strivepharmacy.com. We're really easy to get a hold of, and we just want to be here to support you. So we thank you for joining in the first Strive sessions. We're just so thrilled to have you. Whether this is your first experience with Strive or you've been with us from the beginning, we love having you as part of the Strive family, and we can't wait to continue the relationships. Thank you.
Thank you.